on that in 2007, 80 in 2008, and we're expecting over 100 this year. So it's a growing program and growing recognition. We have new statistics out for Indiana. Really good news, and some of you are probably responsible for this. The folks in Indiana that have over age 50 that have had colonoscopies or screening for colon cancer has significantly increased. We have gone, back in 2002, only 44% of those folks did that. And now we've got over 59%. That's a big jump in people that are taking seriously the early detection of colon cancer. And we know that's very treatable if we find those polyps early on before the cancer. Now, obesity, I do want to talk about this. There's some good news around obesity in Indiana, and that is that we have plateaued. We have stopped the 1% increase every year in our population's level of obesity. And so we are now at 26.9%, and that's actually a little decline in our percentage. These are the latest figures from CDC. It's not a significant decrease, so that's the bad news. We haven't significantly decreased, but we've plateaued. And the ugly news around obesity, which has nothing to do with Indiana, but other states have continued to increase. So now we have a number of states that are over 30% of their population. They have continued that 1% rise, which means that our state ranking, which at one time was, I think, 4th most obese back in 04, 05, we were 10th most obese, and now we're like the 23rd or 24th. I just saw these numbers. I was so shocked by our ranking. I can't remember the exact number. But we have had a marked improvement in our ranking. We're in the middle of the pack now for obesity in the United States by ranking. I guess that's good news, but we've got a long ways to go because we have not significantly decreased that, and it costs a lot. Mammograms are up. We've had more women. We've got 73.8% of women over 40 having mammograms within 2 years. Now, the bad news. Bad news is diabetes. 9.5% of our citizens, our adults, have diabetes, and that's increased over our last level of diabetes. Now, we know if we improve obesity, there's going to be a lag time with that diabetes. But diabetes is something all of you, with your employees, you can make a difference. And I hope all of you engage and learn a lot from today's session on that. We've also seen a decline in women getting pap smears in 2008, and I suspect the economy had something to do with that, probably had some impact on that. And then physical activity has decreased some too. That's one we don't want to see slipping, so we've got to all be out there rallying. When I think of the category of ugly, I do think about the uninsured. The good news is we actually have one of the lower rates of uninsured across the nation because of the cigarette tax and the Healthy Indiana plan that went into effect. We have decreased actually our percentage of uninsured. But when we look across the nation and across our state, those that do not have insurance are those that use the most expensive care. When they do have disease, they're going to emergency departments, they're seeking care in the wrong places at very high expense, and we all bear that cost. I mean, there's no question that across the board we all bear that cost. So I'd put that into the ugly category. And then just to finalize, do I have a second? Okay, and I would be completely remiss as your state health commissioner if I didn't mention H1N1. And so I hope you're washing your hands. But the good news on H1N1, the latest news is we have a vaccine. The vaccine will be coming soon. We do have target groups, so for your employees that are in the target groups of pregnant women, or they live with a child under 6 months of age, or they have chronic disease themselves, healthcare workers, those of you with hospitals and so forth, healthcare workers, emergency management folks that will have direct care. All of those folks are in the priority, the target groups where we want to get the vaccine into them first, and then our children. And children 6 months to age 24 are in the target groups, so our college campuses, high schools, junior high, elementary. If we get those folks vaccinated early on, that's going to decrease the disease out there and start protecting the rest of us, and there should be enough vaccine for all. But what you all can do in the meantime, because flu season, we saw, starting last week, we've had a big uptick in the number of flu cases across the United States. It's coming. It may be here in a larger amount than we would like before the vaccine is in folks and they can develop the immunity. So the hand gel, washing hands, as businesses think about the shaking of the hands, might want to rethink some things there. And then please have your employees stay home when they're sick. I mean, because that's going to limit the spread very nicely. The bad news on this, it's diverting attention and resources away from other things we'd like to be working on, but it's here, it's reality, we got to deal with it. And let's hope that it stays a mild disease, because overall it's causing mild disease in individuals. That it hasn't changed genetically, the virus is still the same, and so let's pray that it stays that way and does not become a severe pandemic. And in the case of a more severe pandemic, I hope all of you have continuity of operations plans in your businesses. But anyway, so let's stay on the good side of all these things, and thank you very much.
Thank you very much, Dr. Monroe, and we're going to take a 5-minute break so everyone can go out and wash their hands. That's a joke, just kidding. Now it's time to recognize Indiana's healthiest employers. This program was organized and created to recognize those companies that proactively shape the health of their employees. It's designed to raise awareness about what companies are doing with the goal of having a healthier workforce and obviously, hopefully,